Welcome to Innovations in Healthcare. I'm Karen Pribno, the Breast Cancer Nurse Navigator at St. Elizabeth Breast Care Center. Being diagnosed with cancer can be scary and overwhelming. At the Breast Care Center, we want you to know that we'll treat you like family and we are with you every step of the way. Follow me inside and I will tell you how we help a patient through their entire journey, from diagnosis to survivorship. Welcome to the Breast Care Center. I have been an oncology nurse for over 20 years, and I am also a certified breast cancer patient navigator. As a nurse navigator, I am an advocate for you. I can answer questions from diagnosis through treatment. I am also here for referrals, such as nutrition or physical therapy, and I am here to offer you encouragement every step of the way. Your best chance of detecting breast cancer early are through mammograms, self-breast exams, and clinical breast exams by your healthcare provider. Here to tell us more is Dr. Michelle Ellis, family medical practitioner.
Well, as a family practitioner, we are on the front line for breast cancer detection. Usually how we become involved, it's either via a routine physical, where a female comes in to have an annual exam, and as part of that we do a breast exam, or a female's noticed that she has a lump in her breast or other skin concern and then comes to the office for further evaluation. And then depending on what we find, they go through next step of getting additional imaging, and if anything's positive, then they'll meet other members of the care team to determine the best plan of care. Unfortunately, 1 in approximately 8 women will be touched by breast cancer in their lifetime. If we're able to detect this early, it increases chances for a successful treatment. So by coming in and getting routine physicals or coming in when an abnormality is first noted, we're able to catch things right at their infancy and then treat them effectively so that it's not an ongoing problem. We recommend doing self-breast exams starting at age 20. Best time to do that is after a woman has had her menses. It's just easier to detect abnormalities, but any time is appropriate. And when they come in for their physical, we show them how to do that so that they know what they're looking for and what's concerning. Generally speaking, age 40 is where we start doing annual mammograms. It can be every 1 to 2 years until age 50, and then usually between 50 and age 70, they're yearly after that. If someone has a family history for breast cancer, depending on how many people are affected by breast cancer or the age at first diagnoses, it will likely make the screening start at a younger age for that individual. The survivorship care plan that's put together by the team gives the primary care provider an absolute outline of what's gone on with this patient's care. It lets them know what kind of surgery they've had, chemotherapy, radiation, and recommended follow-ups, which is beneficial for patient care as they go forward with their primary care team. Fantastic quality of care here. It's very comprehensive. We have excellent surgeons, radiologists, our oncologists are fantastic, and that's just our medical providers in the first line of it. Beyond that, we have wonderful nurse navigators. We have a genetic counselor for women that have a very strong family history for breast cancer so that other family members can be screened if needed as well. Very comprehensive program. I'm proud to be a part of it.
My name is Kelly Wolf, and I'm a registered mammographer at the St. Elizabeth Breast Care Center. A mammogram is the best way for early detection of breast cancer. It can detect breast cancer way before symptoms would even appear for you. A mammogram is a digital screening of your breast tissue. We'll do 4 pictures. We'll use low-dose radiation to get those pictures. We'll take 2 pictures of each breast, 1 from the top and then 1 from the side. Helps my doctor get the best diagnosis they can. A lot of people are always worried about the compression of that exam. We'll just do the best we can to make you as comfortable as possible, and if it's ever getting too tight, you just let us know. Our mammograms that we do here are all digital. We are the first to have digital mammography here at St. Elizabeth. We collect those images and they are electronically sent to the computer, and a radiologist will look at them, and then they have the opportunity to magnify, enhance, and brighten those images to make the best possible diagnosis for you. There is 2 types of mammograms. There's a screening mammogram, which is an annual routine screening for an asymptomatic patient, meaning you have no clinical symptoms whatsoever. And then there is a diagnostic mammogram, which occurs when you are having some sort of breast symptom, or a screening mammogram shows some sort of abnormality. If a suspicious area is found on the mammogram, a biopsy may be ordered by a healthcare provider. A biopsy, there's many different types of biopsies we could do, but they all involve sampling breast tissue and then sending that to the pathologist. The pathologist will then look at it under a microscope with many different tests and give a diagnosis to you as a patient. At the St. Elizabeth Breast Care Center, we make turnaround time our priority. So at the time of the biopsy, you'll meet with a nurse navigator and she'll chat with you, make sure you have any questions that you have answered, and then she can talk to you about potential treatment options if in the event of a positive biopsy. At the St. Elizabeth Breast Care Center, on average, it's 7 days from diagnosis to treatment compared to the national average, which is 21 days. We want you at St. Elizabeth to get back to your normal life sooner.
An oncologist may be part of your medical team. We have 2 oncologists here today to tell us their role in the treatment process.
I'm Eric Avery. I'm a medical oncologist here in Lincoln. Medical oncology essentially refers to the cancer treatment of breast cancer and other cancers. Often that involves chemotherapy or other hormonal therapies. From the medical oncologist, or from my standpoint, we really focus on treatment of breast cancer and other cancers, but really breast cancer after surgery, occasionally before surgery.
Once a person is diagnosed with a cancer, they would typically come and visit with a medical oncologist. And our role at that point is going to include staging the disease, determining how extensive it is, and consulting with the other specialists involved in the case to determine what the most appropriate therapy may be for them.
The Breast Care Center gives us the opportunity to work together as a team with surgery, radiation oncology, the nurse navigators, and all of the other parts of the team to take care of breast cancer patients here in Lincoln.
In Lincoln, we utilize a multidisciplinary tumor board, and these are meetings that are community-wide that allow all of these specialists to come together in one room, and we're able to discuss challenging cases. Lincoln physicians have always been very aggressive in putting patients on clinical trials. In fact, the medical oncologists in Lincoln have traditionally outperformed physicians in other parts of the country as far as percentage of patients that are put on trials. We currently have many trials available to patients, and we're always on the lookout to find new, exciting, cutting-edge therapies for patients. Many times there's a lot of anxiety associated with being told that you might fit into a clinical trial. Patients don't want to feel like they're being experimented on. We try to spend as much time as we can explaining the trial to them and explaining that these trials may be providing them access to cutting-edge therapy that they may not otherwise have available to them. And we want to emphasize the point that they may not only be helping themselves, but they may be helping everyone else that has that disease.
Breast cancer and breast cancer treatment there's a lot of different options for that, and we need to be able to make sure that everybody is working together and working as a team, communicating and trying to keep people here in Lincoln so that they can be near their family, be near their friends, and be near their social support is very, very important for your health as we go along too.
At the St. Elizabeth Breast Care Center, we believe that simply knowing what to expect will eliminate your anxiety and give you a better experience. That's why we offer the only pre-surgery class in the area. Every week I hold a free Preparing for Breast Surgery class. Participants learn what to expect before, during, as well as after surgery. We talk about steps that you can take to reduce your risk of developing lymphedema. We also discuss clinical trials and what's found on a pathology report. We also talk about what resources are available here at St. Elizabeth as well as in the community. Physicians at the Breast Care Center work very closely to make the surgery process go as smooth as possible. Here to tell us more are Dr. Rick Wendell and Dr. Todd Orchard.
Hi, I'm Rick Wendell. I'm a general surgeon in Lincoln, Nebraska, and I've been practicing breast care for 35 years. Cancer, and breast cancer in particular, is sort of the ultimate team sport. And I know that what we want to do here is not only answer every woman's question and every family member's question, but help them feel as comfortable as possible, knowing they're getting the very best care they can. Well, I think it's important to understand that almost all women do extremely well, and that's the takeaway message from breast cancer today, is that people do well with breast cancer. Surgery actually has become a much safer and easier part of treatment than it used to be, and it's something we do primarily as an outpatient. Most of our patients can get by with, the terminology would be lumpectomy. The more accurate term we call it partial mastectomy, but it's where we take a small amount of tissue out of the breast. It does not create a cosmetic deformity. It's done through a small incision. This is done as part of an outpatient procedure. The next day you can shower, bathe, drive a car. It's oftentimes combined with the sentinel node operation. And so we go in and identify a lymph node that is near the breast in the armpit and take that out as part of the total surgical staging procedure for breast cancer. Let's say 95% of women qualify for breast preservation or lumpectomy, but a few women will require more surgery, as in breast removal. People that are more inclined to do that might have larger tumors, or they might have strong histories in their families, or they might be patients that carry special genes that create more risk going forward, like Angelina Jolie. For those patients, we work with the plastic surgeons doing a one-stage operation, meaning all at the same time, where a person like myself might be in charge of the breast removal and any lymph node retrieval we do, and the plastic surgeon comes in immediately and does the breast reconstruction. The new forms of breast reconstruction are much improved over what we had even a few years ago. So the example is that the breast form, when we're done, is a very natural shape, such that at 10 feet it would be hard to tell that a woman has had breast reconstruction. So doing it in one operation, one visit to the hospital, the patients are very, very happy about this, and they're very happy about the cosmetic outcome. They can wear all of their clothing that they had before in a way that you can't tell that they've ever had surgery. We think every patient should have a pain-free experience, and with the help of our anesthesia team at St. E's, we are putting pain catheters or tubing just outside the spine along the backside, so that when patients wake up, they're completely pain-free, and they'll remain pain-free for up to 5 days, requiring no medication post-procedure. It also saves a day in the hospital. Now, this kind of pain relief also helps reduce the risk of the cancer coming back in the future. So we know it's an important thing to treat the whole patient as a team at St. E's.
It is my pleasure to talk to you about the advantages that the City of Lincoln gets from St. Elizabeth's Breast Cancer Center. We have, over the last 3 to 4 years, started using a one-stage breast cancer reconstruction technique that allows a woman to have her mastectomy and have reconstruction, so her recovery is completed in weeks, not months. It's also an advantage for the City of Lincoln that I know of no other location where a woman can be diagnosed with breast cancer, treated to her level of completed reconstruction within weeks' time. Women love the fact that they can have their procedure done and over in one technique, one surgery, as opposed to some other locations where they have 3 to 4. The benefit to the woman is actually multifocal. She has a much quicker recovery time. She has a psychological benefit of not having to look at the mastectomy defect. She can look at herself as a fully reconstructed cancer patient at the completion of the procedure. The acceptance has been universal. I think Lincoln is blessed from the standpoint of I know of no other place around that allows the group of people to work together like they do in Lincoln. The ability for us to talk, converse, come up with treatment plans, and treat the patient as quickly. I know of no other location that can do it as quickly as Lincoln does it.
If you have a personal history of breast cancer or a family history of breast cancer, you may benefit from genetic counseling. Here to tell us more is our cancer genetic counselor.
I'm Stephanie Persich, and I'm a cancer genetic counselor at the St. Elizabeth Breast Care Center. Well, we know that about 5 to 10% of all cancers are hereditary, so that means they're passed on in families. So what I do is I meet with people that maybe have a family history of breast cancer, or perhaps they themselves were diagnosed with breast cancer at a relatively early age. And when I meet with somebody, we talk about their history of cancer, we talk about their family history, and determine whether or not they would be a candidate for genetic testing to see if they carry a gene change that puts them at a higher risk of developing breast cancer. Well, when I meet with somebody, the initial consultation to talk with me is provided at no charge to the patient or to their insurance. And what we really do is just get more information about the patient's history. We want to get information about their family history of cancer, people in the family who have had cancer, as well as people who have not had cancer. And then we kind of look at the full family history and see if it looks like the cancers in the family can be related. And if they could be related, then we talk about, do these cancers go together in a specific hereditary cancer syndrome? And then I would talk with the patient about that specific syndrome, about the cancers associated with it, the cancer risks, and then the management options they have to help decrease the risk of developing a specific cancer. Genetic counseling and testing can provide information for the patient regarding their own cancer risk, can provide information for family members regarding their risks of developing cancer, and it can also allow us to provide management recommendations for the family and for the patient so they know best how to manage their risk for cancer. Things we look for if somebody's concerned about hereditary breast cancer would be breast cancer diagnosed at an early age, so usually before the age of 50. Several relatives in the family with breast cancer, especially if they're really closely related relatives. We also know that breast cancer can go together with ovarian cancer. So in some families, we might not see a lot of breast cancer, but there might be a couple people with ovarian cancer, and then we get concerned as well. We look at both sides of the family, so these genetic changes can be passed on from the mother or the father, so we have to look at the father's family and see if there's any breast cancer on that side, as well as the mother's side of the family. If the testing comes back positive, that tells us that the patient could have a higher risk of developing breast cancer. So for those patients, they can get breast MRIs in addition to mammograms. They can choose to have their breasts removed prior to even developing cancer. And if we know they have an increased risk of ovarian cancer as well as breast cancer, then we would recommend they consider removing their ovaries too. It can provide a lot of relief. Sometimes the test results come back negative, and that means you don't have an increased risk of breast and ovarian cancer in some families. Sometimes we can reassure the patients. They might think their risk for cancer is higher than it actually is. And we can also provide them with information about how best to manage that risk and information that they can then pass on to their family. Members of the breast care team can refer patients to me. Patients can also self-refer, and then I communicate with our navigators, with our physicians, with our other providers in the breast care team to inform them of the patient's genetic test results and what we discuss so that we can all work together to manage that patient's cancer risks.
St. Elizabeth Breast Care Center is proud to be the only hospital in the state and in the Midwest to offer a new radiation therapy called AccuBoost for women fighting breast cancer. Let's step into the treatment room and learn more.
Hi, my name is Dr. Kevin Yee. I'm a radiation oncologist. I'm also the medical director of the Radiation Therapy Center at St. Elizabeth's. In terms of breast cancer, radiation therapy is often used after surgery. Patients who undergo a lumpectomy or mastectomy often need radiation afterwards, and so typically we would start radiation 3 to 4 weeks after they've completed their surgery. The most traditional way of giving radiation is through external beam radiation. So after the surgery, the patient returns after she's had a chance to heal up, and then she receives 5 weeks of external beam radiation to the entire breast. After those 5 weeks are completed, we then perform a boost, and the boost can be done either with more external beam radiation or with the AccuBoost brachytherapy treatment. So AccuBoost is a newer treatment that also delivers a boost to the tumor bed. So after the surgery, the highest area of risk of recurrence is actually where the tumor used to exist. For many years, we've used external beam radiation to deliver 5 additional treatments to that area. The downside of that is when we deliver it through external beam radiation, there is more dose to the lung, to the heart, to the chest wall, all areas that we don't want to get radiation. The AccuBoost is actually a radioactive source that we place on the skin itself. And by doing it this way, we minimize radiation to those areas that we don't want, yet we still have a high cure rate by using the AccuBoost. The people who are eligible for AccuBoost are people who've undergone a lumpectomy, And after the lumpectomy, clips are placed by the surgeon so that we know exactly where the tumor used to exist. And then afterwards, these patients would then go on to begin with the AccuBoost. There's been some recent data published that show that women who've had radiation after breast cancer, sometimes 10 years down the line, suffer side effects such as cardiac problems or problems with the lung. And we're hoping that by minimizing dose to these areas that they don't have long-term side effects so that they're able to have a good quality of life after they're being cured of their cancer. The Radiation Therapy Center here is one component of the whole breast cancer experience, and we work in collaboration with our nurse navigators, with the surgeons, the medical oncologists, and so here we have excellent communication so that we all know what the other doctors and nurses are doing, and you get a team experience when you come here.
As you can see, our cancer care revolves around the patient, guiding them from diagnosis through treatment. So if you or a loved one are diagnosed with breast cancer, you know that you don't have to travel far from home to get excellent care.
People say I'm a hero. I guess that's because I've made it through a long battle with breast cancer.
It's cancer-free.
It hasn't been easy, but I was never alone either. At the St. Elizabeth Breast Care Center, I was with doctors and nurses who worked as a team, with me and with each other. They got to know me, and they knew exactly how to fight my cancer. They tell me I'm the hero, but I know that not even superheroes work alone.